Hello, I'm Manali Phadke. I'm a research scientist in Dr. Kiran Smalley's lab at Moffitt Cancer Center. I've been working in his lab for past 10 years now, and it's mostly a melanoma group. So I started my work with like targeted therapies in melanoma, and for past few years now we have ventured into immunotherapy. So this is my poster. I'm at AACR annual meeting 2023 in Orlando, Florida. And this time my project is about combination immunotherapies in melanoma. So as we all know, melanoma is one of the deadliest form of skin cancers, and most of the patients have the brain metastases with melanoma. Most of them eventually die, and there have been many combination therapies that have been used to treat patients with melanoma. Some of them have shown good effects, some of them have toxic effects. So the common immunotherapies that are used in clinic are anti-PD-1 plus CTLA-4. They have shown good efficacy but certain toxic effects. So currently anti-PD-1 plus LAG-3 is the combination that is being tried. It has shown some good effects in the extracranial tumors and brain, cutaneous and cranial tumors too. So in our project over here, other than looking at the efficacy of these two combinations, we are also trying to explore the mechanisms behind the action of these two combinations, as well as resistance if there is any. This work is mostly preclinical work, and it's in the mouse model, as you can see over here. And interestingly, what we saw was both PD-1 plus LAG-3 and PD-1 plus CTLA-4 show similar efficacy in the extracranial and cranial tumors in the mouse models. However, the mechanism of action is completely different. With PD-1 plus CTLA-4, we found out it's mostly dependent on the activated effector CD8 T cells. Whereas with PD-1 plus LAG-3, we found out it's mostly dependent on the CD4 T helper cells. We are further exploring what type of CD4 T helper cells are playing a role in this efficacy. We also saw that in the cranial tumors, a couple of mice did not respond well. There was relapse. So we decided to explore the mechanisms of resistance. And interestingly, for PD-1 plus LAG-3, we found that it's increased infiltration of MDSCs, which is why the brain tumors were relapsing on this dual combination. So after exploring the mechanisms, what we can suggest is, although both these combinations have shown good effect in the clinic, it could be a better idea to try alternate therapies or alternate combinations to show a longer and more durable efficacy, and also maybe to prevent the resistance to the therapies. So yeah, that is what we'll be exploring further in our project, just so that we have a more durable therapeutic combination for treating melanoma patients.